Hello, my name is Dr. Eric Green. I'm the Internal Medicine Residency Program Director here at Mercy Catholic Medical Center. Thanks so much for tuning into this video. In this video, we're going to try to give you an overview of our current schedule, which we're really excited to say that we launched in the 2021-2022 academic year. We were really excited in our 2021-2022 academic year to introduce our new X+Y curriculum. For those of you who are less familiar, an X+Y curriculum involves dividing the academic year into inpatient-focused blocks and outpatient or ambulatory-focused blocks. In our case, we broke the academic year into 26 two-week blocks. 2 weeks out of every 8 are spent in ambulatory medicine. And that's predominantly primary care clinic, but also some ambulatory educational experiences and an ambulatory academic half-day filled with didactic experiences about ambulatory medicine. The other 6 weeks are spent in inpatient focused or blended activities with time spent on floor, intensive care unit, night float, and different specialty consults. In this system, we were able to preserve the number and richness of our elective experience, so our residents are continue to have the ability to take electives in all of the medical subspecialties, and they continue to have the same number and variety of electives. This includes the ability to do an away elective once during their 3-year curriculum for categorical residents who choose to do so. When you look at our PGY 1-year curriculum at a glance, you can see that it is somewhat focused, as it should be, in inpatient-focused activities like nights, floor, and ICU, with a large chunk of the remainder of the academic year devoted to ambulatory medicine. However, we do have opportunity for our residents to have time and electives as a PGY1. Our PGY2 and PGY3 curriculum have progressively less time spent in inpatient-focused core rotations like floor, night, and ICU, with the remainder time being filled by increased elective opportunities as well as by opportunities for our subspecialty rotations like our admitting officer of the day, which is a really amazing rotation where residents get to be point of first contact for our patients being admitted from the IC, from the emergency room to the floor, so our observation rotation. So when you look at our schedules, we really try to make sure we balance our residents' work and life to make sure that the schedule and the academic environment at Mercy is one that is conducive to our residents having the optimal learning environment. This starts actually with our decision to do a X+Y schedule. This was motivated by our residents who felt that the increased tension between the inpatient and the ambulatory in our previous hybridized blended model of curriculum was actually detrimental to their education, as well as input from our faculty that the older model of scheduling cadence didn't reflect the actual complexities and nuances of modern medicine. It extends to how we have our residents select their schedules. So our residents spend time each spring selecting a cadence or track of rotations, which allows them to synchronize their personal lives with their work lives, so that they are scheduling vacations and less intensive rotations to times where that's congruent to events in their personal life. It goes down to how we schedule our blocks. So many of our blocks have at least one weekend that is a quote-unquote golden weekend where residents have no patient care responsibilities, and all of them include 1 day off at 7. Notably, our night rotation is a 5-night only rotation. We felt like 6 nights a week was actually not really the optimal learning environment given sort of the stressors of being in an off-circadian rhythm rotation. It then extends down to how we organize the details of our daily and hourly rotations, making sure that every decision we do starts with saying, what is it that makes our residents' learning environment the best? So for example, we understand that even doctors and their families get sick. And we have a built-in jeopardy system that allows residents, when they need an occasional sick day, to take it without risk of penalty or repercussion. They simply get added to a greater pool of sick pool, and then at some point in the future, they may have to repay that for up here. When you look at our daily schedule, it's a mixture of scheduled 9 and scheduled 12-hour shifts. We used to have an overnight shift, a 24-hour shift. However, our residents felt like the tensions of working a 24-hour shift were not conducive to their learning, and so we eliminated it. Because, again, our focus is on creating the best learning environment we can for our residents. This is a snapshot of our team-up calendar. Our team-up calendar features all of our didactics. Now, clearly not every resident goes to every single didactic, but you can see that our days are filled up with multiple didactic opportunities. The center of our didactic activities is our core noon lecture series, which is an 18-month lecture series that features core topics of internal medicine, as well as our medical grand rounds series, which features speakers from many of our local university hospitals, and our morbidity and mortality conferences. This is supplemented by an academic half day for our ambulatory residents, which allows our faculty to go into a deep dive on ambulatory specific topics, as well as a diverse range of learning activities, including morning reports, journal clubs, our ethics rounds, which are much more to do with medical legal medicine than classical bioethics, antibiotic stewardship rounds, where residents will rotate and look in depth at antibiotics with an infectious disease physician. This doesn't include our patient-facing rounds, our rounds with our hospitalists and intensivists, which are focused in on patients. Indeed, every once in a while, I'll see a criticism in our online learning management system that our residents feel like they have too much time spent in didactic activity. While I understand the tension that that puts in their clinical obligations, I think that that's the right tension. We should always have ample time spent in didactic activities. Thanks again so much for sticking with this video and listening to us. Please explore the rest of our website, including the other videos we have, for more information about the residency here at Mercy Catholic Medical Center.